My name is Mike Barron. I'm a general cardiologist at Indiana Heart Physicians, Franciscan Physician Network. I started in the year 2000. Everybody realizes it's scary. It's scary to have heart disease, and we know how dangerous it can be. But what is gratifying for me and why I keep loving to do what I love to do is that when you meet somebody in the hospital and they're very sick and you're able to get them through that moment the best you can, then it's very gratifying to see them now in the years to come, where 5 or 6 years later, the office visits are somewhat uneventful because they have stabilized and doing better. That is very gratifying as a physician. I've always been interested in congestive heart failure, dysfunction of the heart, and what can you do with medicines and procedures to try to restore function or preserve function. The other area of interest is heart valve disease. If you hear about people with leaky heart valves or a blocked heart valve and how that relates to the cardiovascular status, I've developed a special interest in heart valve disease, and that honestly works very nicely with congestive heart failure because they can run hand in hand. I am married and I have 3 daughters, and they're in the high school, junior high area, so I'm obviously very busy with them and their activities. I'm a jogger. I'm not competitive anymore. I do that. We try to get away. We have a lake cabin that we go to in the summer. I think Indiana Heart has done a nice job. We have developed people with special interest in my world, congestive heart failure. I think at least for a while we had the first heart valve clinic in Indiana, and we're always looking to innovate and find the new areas of care that may be coming down the road, and we can learn from each other, and we each have kind of certain disciplines that we try to excel in.